Hi, my name is Colleen Tantello. I'm here to educate you about home care nursing with the oncology patient. This can be very challenging at times, especially for the patient and the caregiver. As nurses, we want to make sure we're educating the family and the patient as much as we can. The most important factor for oncology patients is prevention of infection. These patients are neutropenic, which means their neutrophil count is below 1.0. They're definitely at high risk for infection. So we want to educate the patient and the family to make sure they do very good hand washing, and to also encourage any patient's family or friends that come over to make sure that they're washing their hands. I had one patient that actually had Purell right outside her front door, which was great. Anyone that entered the house had to use that. Also, as the nurse, you're going to want to make sure you do very good hand washing and put on some clean gloves before assessing the patient. Assessing the patient, you're going to do a complete set of vital signs. You want to make sure that their blood pressure is stable, their heart rate, their oxygen rate, their temperature. Another factor is pain. You want to make sure that these patients are comfortable. Many of them will come home with some oral mucositis where they can have some mouth sores in their pain. And you're going to do a lot of educating to the patient and the family. You're going to do a full head-to-toe assessment that includes the skin. You're going to look for any rashes, any open areas. You want to look for petechiae on the legs and the arms. You want to listen to their lungs. Make sure that there's no wheezing, there's no tightness in the chest. You want to listen to their heart. You want to listen to their bowel sounds. You want to make sure there's no fluid on their extremities. You're also going to check their venous access. Most of them will be coming home with a Metaport or a central line. You want to make sure that's not red or swollen or any drainage. You're also going to make sure that their bowel function is doing okay, that they're having stools. And you also make sure if they are having a diarrhea, how often are they going? What's the consistency? Another factor is appetite. You want to make sure the patient's not having nausea, vomiting. If they are, you need to do education regarding that, what they can do, what will help improve their appetite. You want to make sure that they're drinking small, frequent meals throughout the day. Another factor is you want to make sure they're drinking enough fluid. You want to make sure, I used to tell patients, always have a water bottle next to them at all times, just as a reminder to drink. They need to drink plenty of fluid to prevent dehydration. Fluids are a marvelous thing, can do many things for patients. After that, you're going to make sure they're not short of breath with ambulation, not short of breath at rest. You want to check their sleep pattern. How well are they sleeping? Are they getting enough sleep? Is the caregiver getting enough sleep? And how is the patient and the family coping? This is a huge thing. How are they coping with everything? How are they handling things at home? Next, you're going to most likely draw blood through the venous access. You will draw their blood, and you're also going to be teaching the family how to flush the port, how to change dressings. Next is the very big thing, education. Educate. There are so many things that we need to educate the patients on going home, especially after receiving chemo. You want to make sure that you answer all questions. You're going to educate the family about the central line. You're going to educate them about when to call the providers. When a patient has a fever above 100.5, if they're short of breath, nauseous, vomiting, diarrhea, you want to make sure they know when to call and who to call at all times. And the last but not least, last thing, any questions? Are there any questions the patient or family may have? You want to make sure you answer those thoroughly for them. This was my first time uploading a video. I'm very excited about this. It took me a while. I finally got it up. I think it's a great opportunity to help educate you students. You can also utilize these for patient care, patient and family education. So this is a great opportunity. And that's about it. I'll talk to you guys later.